The Wolfe Eye Clinic participates regularly in national clinical trials for the advancement of retina diseases, such as macular degeneration. Their research has been part of some new approvals that can really make differences for patients across the world. Dr. Daryn Nielsen, retina surgeon and director of clinical trials for Wolfe Eye Clinic, joins us now with more. Good morning. Thank you so much for being here.
No, it's my pleasure. Happy to be here.
Well, first of all, tell us what macular degeneration is. I think we've all heard of it, but may not know exactly what it is.
Yeah, macular degeneration, unfortunately, is the leading cause of permanent vision loss in patients over 65 here in Iowa and really in the country. And what happens is that you have a degeneration or degradation of the retina right in the center part of the vision, which we call the macula. And when that retina degenerates, you have a hard time seeing right in the center part of the vision. It often affects both eyes. It keeps people from reading, driving, seeing faces, doing things that they like to do.
Now, what is the difference between wet and dry macular degeneration?
Yeah, that's an important distinction. Dry macular degeneration starts out where the tissues begin to degenerate and become thin or develop small degenerative bumps called drusen underneath the retina. In dry macular degeneration, as it progresses, the retina becomes very thin and it develops into a condition called geographic atrophy. Wet macular degeneration is sort of an add-on to dry, and in that circumstance, you get abnormal blood vessels that attack right in the center part of the vision. And those blood vessels cause severe damage pretty quickly to the center part of the vision if not treated.
What are some advancements in macular degeneration then and now, specifically recent clinical trials you've done at Wolfe Eye Clinic, and then the ongoing advancements in retina disease treatments?
Yeah. So treatment for wet macular degeneration was revolutionized in about 2005. And they require injections of medicine painlessly into the eye on a regular basis in order to fight wet macular degeneration. All the advancements that are being made now are trying to reduce the treatment burden, less frequent injections, and improve vision outcomes. And we've recently been a part of a trial that just a few weeks ago announced that instead of having a monthly or every other month injection, that about half the patients could be treated just every 4 months, which is amazing. And to be able to do that and protect vision, to keep people seeing and driving and doing the things that they like to do, that's fantastic.
Yeah, that is amazing. So if we are having these issues ourselves or know someone, what can we do?
Well, if you do have macular degeneration in your family and you're over 55, you probably need to have a dilated eye exam with your general eye doctor. If they determine you have macular degeneration, then you should start taking a vitamin supplement called an AREDS vitamin, and that can delay the advancement of neovascular or wet AMD. And so if you have that disease or it runs in your family, work with your local eye doctor to make sure that you're on the appropriate vitamin supplement and you're being watched very carefully.
Dr. Daryn Nielsen with Wolfe Eye Clinic, thank you so much. This is great information on such an important topic.
Absolutely, my pleasure. I hope you have a great morning.
You too. Clinic is located at 6200 Westtown Parkway in West Des Moines. For more information, you can call 833-474-5830 or visit wolfeyeclinic.com. You can also check them out on Facebook and YouTube. The handles are right there on your screen. After the break, it's time for this month's Golden Apple Award winner. From his patience in the classroom to his active support, see how this math teacher from Bussey is working to give students the best learning experience possible, and how you can nominate your favorite teacher.